Hello everyone. This is one video out of a series of videos that talks about various kinds of birth control methods. It's important to realize that this is basic information. It's really important when you decide that you want to go on birth control that you get an appointment with your healthcare provider. You talk about your medical history because sometimes there are things that are contraindicated in using various kinds of birth control, and that you have that more in-depth conversation about what is going to be best for you. So just realize that this is just basic information about various kinds of birth control, and this is just one of them of a series. I hope you enjoy them, and again, if you have any questions at the end, don't hesitate to email me. Thank you. Hello everyone, Lori from Women's Health on the Go. This video is about IUDs. There are basically two different kinds of IUDs. There's the IUD that's good for 10 years and doesn't have any hormones. And then there are the IUDs that have hormones, but there are two types that I know of right now that are on the market. There's one called the Mirena, which is good for 5 years, and then there's Skyla, which is good for 3 years. Now, what are the differences? So first off, here's a picture of a Paragard, okay? As you can see, I'm not quite sure if you can see, like, that's actually copper that's on there, okay? So there's no hormones at all in there, and it just has the copper, which creates basically an unfriendly environment for implantation. It helps kill sperm, that's how it works, and that's good for about 10 years. Of course, if you decided in 5 years you wanted to have children, you just have to take it out. It's just good for up to 10 years. The biggest, I would say, side effect that people don't like about it is that your periods can be heavier than they used to be. Typically, this will just happen for the first 6 months and it'll then adjust itself and it'll be fine, but sometimes that doesn't happen with people and their periods are always heavy. So that's the drawback of a Paragard. The Mirena and the Skyla, which are hormones, they're just progesterone. This is a picture of a Mirena IUD. So if you've seen my video about the Depo-Provera, it has the same kind of side effects as the progesterone-only injection. What will your bleeding pattern be? I don't know. Typically, most people won't bleed once they have it, but sometimes people can spot all the time, sometimes people can still have their period, and sometimes people can have a lot of irregular bleeding. There is only progesterone in it. There's no estrogen, and estrogen is what keeps our bones nice and strong, so it'd be important that you actually take a calcium supplement. There is debate. A lot of places say that it doesn't cause weight gain, but I've seen a lot of people who've actually had those kind of IUDs, and they do gain about 5 to 10 pounds. Some people have problems with like depression. And the really important one that I like to always tell people is about your fertility. Let's just suppose you have the Mirena and it's been in there for about 3 years and you want to get pregnant and you want to have it taken out. Some people, fertility comes back within a second, but then other ones, it can sometimes take up to a year to get your fertility back. And I think that's really important when you're trying to decide which kind of birth control is right for you. If you're looking at your long-term kind of goal of, you know, hey, I want to have a baby in 5 years, or I don't want to have babies ever again. So basically the way that IUD it's inserted, it's something that goes inside the uterus, and it stays right inside the body of the uterus. It's an in-office procedure. It's done under sterile technique. The risks associated with getting an IUD is 1, infection, which it is done under sterile technique, but there is always that possibility, and 2, puncturing the wall of the uterus upon insertion. Now, how often does this happen? It's very rare. Of all the people that I know who do this job, I know of one person who a long time ago perforated the wall of the uterus, and the woman was fine, recovered, had children after. And I know a lot of people who do women's health, so it's not very often that that happens, but it can happen, and it's something that you should know. Insertion. If you've had children before, insertion is fairly easy, because if you think about if you've had a vaginal birth, your cervix is opened up and now it's gone back to being closed, and it doesn't close as tiny as it was prior to you being pregnant. So for people who've had babies before, it's fairly simple to put in. For those who have never had children, it can sometimes be a little bit of a challenge. Most people who do get it put in and they've never had children will say that it was not the most comfortable thing I've ever experienced. But a lot of people say in the end, it was well worth it. So just realize that if you do get that insertion and you've never had children before, it may be a little bit of a challenge and it may be a little discomforting when you have it inserted. But a lot of people say that afterwards they're very happy they did it. It was the best thing, and they're very happy with their IUDs. Are there people who are not happy with their IUDs after? Absolutely. But that happens with any form of birth control that we try. So that's kind of IUDs in a nutshell. I hope this was very informative for you. I hope it helps you make your decision about what type of birth control you would like to use. If you have any further questions about anything about IUDs, please do not hesitate to email me. I would be happy to answer any questions you may have. Thank you for watching my video, and have a great day. And remember, women's health matters. Thank you.